me, Rebecca, your student nurse today. Now we're going to be cleaning your trach. The procedure is going to take about 15 to 20 minutes, but once we're all done, your trach will be all set and clean. It looks like you're already in the position that we need you to be in, but can I please have your name and date of birth, please? Alrighty, and any drug allergies? Alright. So, like I said, you're in the position that we need you to be in the semi-fowler. So I'm going to take your vitals now. I'm going to check your respiratory rate, your O2 saturation, your heart rate, your lung sounds, and I'm also going to take a peek at your incision site as well on the trachea. Alrighty, so let me take a peek here. Take a couple deep breaths. Okay. I'm going to take your cover off here. Alright, everything is looking good. So I'm going to open my tray now, or my kit. Alright, I'm going to hand sanitize. And now I'm going to put on my gloves, but I touched my hair, so I'm going to hand sanitize. Alright, so I'm going to put on my sterile gloves. Alright, so I'm going to use the cover of my tray to set up my tools. But I'm going to put this on you so nothing gets on you here. I want to make sure the shiny side is on the patient. Alright, there we go. Okay, so I'm going to put all my tools on this cover here, so I can use the basins. Okay. Now I'm going to pour my solution. So I have normal saline within day, and I'm going to do that in 2 of the basins here. Pour that in. Alright. I want to make sure that I put the day and my initials on there, so it's only used for this patient. And then I also have the hydrogen peroxide, so within day, so I'm going to put this in here as well. Alright. Alright, so now I'm going to remove your trach and your gauzing. Alright, we're going to put this in the hydrogen peroxide so it can soak. And I'm going to take your gauzing here, your soiled gauzing, I'm going to toss that into the waste bin. And then I'm going to also toss my gloves as well since they are soiled. Alright, and I have my new gloves here. So I'm going to put these on as well. Okay, so now that I have my new gloves on, the trach has been in the hydrogen peroxide, so we're going to use the scrub here to kind of make sure that it's all clean. So we're gonna use this to go in. Make sure it's all clean here. And then we're gonna rinse it in the saline basin here. And then we're gonna use the pipe cleaners to dry it out here. We wanna make sure it's nice and dry. There you go. Okay, so now I'm going to place the trach back in. There you go. All right, so now I'm going to use the second basin of saline and clean up around your trach area here with the gauze. So we're gonna use this, put it in the saline. All right, so I'm just gonna clean around here, make sure it's nice and clean. All right, now I'm going to put the new dressing on. Make sure it's open here. There you go. And now I'm going to replace the ties. Make sure that one side, that they're tied still, but you want to make sure that when you have it one side on, the old tie is still on. So I'm going to lift your head up here. All right, tie it on. And now I'm going to put your cover back on. Remove my glove. Well, no, we're gonna take this first. Take this. Remove my gloves. All right, sanitize, and then I'm going to document what I did, and if there was any inconsistencies within the vitals or within the trach itself, if a new trach needed to be done, if it was a disposable trach as well, and yeah, and then I will check in on you soon.